morning to all our participants from the Europe, and a very good afternoon to everyone who have joined us from the Indian subcontinent. We are very glad that you're here, and we are delighted to welcome you towards the webinar on injury prevention and rehabilitation in high-performance sport. Before we start off with, we would like to play a quick video for your quick reference.
Hola, ¿qué tal? Son las 7 de la mañana, las 6 en Canarias y por fin es lunes.
Tengo que levantarme temprano. Tengo que entrenar.
Tengo que estudiar para el examen.
Mañana tengo que presentar un trabajo
con la universidad.
Tengo que seguir mejorando. Sé que lo voy a conseguir.
Lo voy a conseguir.
Tengo que bajar ese tiempo. No puedo rendirme ahora.
No puedo rendirme ahora.
Tengo que hacer el último.
Líderes en esfuerzo. Líderes en superación.
Sé que puedo conseguirlo.
Sé que puedo conseguir.
Líderes en talento. Líderes en vocación. UCAM. Lidera tu futuro.
Once again, welcoming each one of you, students, coaches, clinicians, sports science professionals, everyone who have joined us today for the webinar. A very warm welcome. My name is Stephen James. I'm an exercise physiologist by profession, and I'll be your host today to take you through this webinar led by the speaker, none other than Dr. Apurva herself. Today's webinar is brought to you by UCAM. UCAM India is an Indian academic extension of UCAM Spain, a globally recognized European university which has been known for its strong emphasis on sports, health sciences, and especially high-performance research. UCAM Spain has been closely working with elite athletes, professional sports organizations, directly involved with FC Barcelona. UCAM has its own club in football, League A in basketball, and so on and so forth, placing it at the forefront of applied sports education. So this is the academic philosophy at which UCAM in India is also focused in on, where we deliver globally aligned, industry-relevant education when it comes to high-performance sport in specific. Before we start off with the session today, for those of you who are interested to know further more about our program, I'm dropping out to you in your chat box our website so that you can refer unto us. And at the same time, if you'd like to chat with us, and we would be happy to guide you in depth in regard to our presence in India, our approach in terms of sports science, research, and our programs in high-performance sport, you could reach out to us through our WhatsApp number, which is, once again, I'm putting it on the chat. You can reach out to us through there. Before we start off with the main session, it is my privilege to invite the leader who has been instrumental in shaping UCAM India's academic vision and growth. Let me welcome Dr. Sunil Rongala, who is the director of UCAM India, to formally open the webinar. Over to you, sir.
Thank you all. Hi, Dr. Apurva. Thank you, Stephen. Good afternoon, everyone. It is my distinct pleasure to welcome all of you to this webinar on injury prevention and rehabilitation. I can tell you, for one, I would need it because I've recently sustained a running injury and I'm in rehab as we speak. First and foremost, I'd like to welcome all our participants, whether you're students, sports professionals, or enthusiasts in the field of sports science. We are thrilled to have you with us. Just a brief introduction of what UCAM is and what UCAM India is. While we are known as the sports university, we are also in the forefront of multiple fields such as robotics, science, medicine, among others. We are UCAM India, while we are offering programs online, we are thrilled that in the next academic year, we have tied up with JN University and we will be offering in-person programs, including the high performance strength program in Bangalore. So that would be a game changer for strength and conditioning education in India. Our strength and conditioning program is designed to integrate sports science as well as practical coaching applications with the objective of making sure students are approaching global standards. In this particular manner, it is our honor to have Dr. Purva from the NSCA, which is doing stellar work in this field, and we are delighted to have a collaboration. And hopefully, this collaboration gets closer in the coming weeks and months. Next month, we have Dr. Pedro Emilio also coming down to India, so we intend to strengthen this. This today's webinar is a testament to the strong partnership UCAM and NSCS share. And I would like to extend a heartfelt thanks to Dr. Apurva Mathankar for her invaluable contribution to this field and agreeing to join our webinar today. Please stay connected with us. We will have webinars on a monthly, bi-monthly basis on this particular topic related to strength and conditioning. We will have many insightful speakers joining us. Thank you all for being with us today, and I hope you have a very informative session.
Thank you so much. As we continue towards the distinguished speaker for today, I wouldn't take much of your time from the main aspect in itself. But let me just quickly introduce Dr. Apurva Mathankar, although we might not need to do that in detailed extension because most of you present here know her work through NSCA and through her direct collaborations one way or another. But we are happy to have you, Dr. Apurva, once again. I know your schedule, in spite of it being tight, giving out your precious time. We really appreciate. We thank you. We really have worked and seen closely how Dr. Apurva's hands-on approach with coaches, hands-on approach with performance professionals across the country has been playing a pivotal role towards the strength and conditioning future generations altogether. In the coming days, I'm sure the evidence-based practice which she is currently on, the Indian sports performance ecosystem will be really taking a big boon. Before I hand over the time over to Dr. Apurva, let me just quickly point out how the program agenda is going to be so that all the attendees are in line with us. We will be having this speaker-led session for the next brief period of time, soon after which we will be opening a direct time of interaction with Dr. Apurva, which I'm sure you all would be eager to utilize that for. So I would keep that towards the end. So if by any chance you have any questions which itches your brain, make a note of it, put it in the chat box so that towards the end we could utilize the Q&A session. And that's how we would be closing it up with. That being said, thank you once again, Dr. Apurva, for being with us. The virtual stage is all yours.
Yes, thank you, Sefin. Thank you so much for that wonderful introduction. And I'm glad that we have got so wonderful participants here for our this workshop. And the university is one of the wonderful university in Europe. So anyone who is looking forward for, for the sports science education or strength and conditioning education, we highly recommend this. And for today's workshop, today's webinar, we are going to talk about sports injury prevention and rehabilitation. So as my work is all into strength and conditioning and return to sport, so we cannot just divide rehabilitation and strength and conditioning separately. It needs to go together. And when that togetherness is there between multidisciplinary experts, then the injury prevention becomes very, very easy. There's not rocket science involved in that. So the first goal, always I say that for strength and conditioning is injury prevention. And if that is done correctly, then the rehabilitation and everything just falls in place in a proper manner. So let me just start the screen share with my presentation here. Yes. So this is our topic today for the webinar. Is everybody able to see my screen correctly? Sefin, is it visible properly?
It is. It is.
Yes. So,
I mean,
yeah. Now, when we are talking about the sports specific injury prevention and the rehabilitation involved in that, first we need to understand what are the main needs and requirements of that particular athlete as well as particular sport. So here, this is something which I always like to follow is that don't just be very superficial that your athlete just needs strength or just needs power or anything. Whichever sport you take, any sport, whichever, like you take an American sport, Indian sport, European sport, whatever, the entire this system has to be in place. Then only the real injury prevention can happen. So here, if you can see you there, we have strength, power, and speed and agility block. Here we have anaerobic conditioning, aerobic conditioning, muscle stamina. So we are working on the cardiovascular as well as muscular endurance here. On the left lower column, you can see the job skills, coordination, mindset, and ODA loop, which is there. The right side, you will see the recovery, nutrition, mobility, and flexibility. So this entire thing, when works together, that is something which we call it as an optimal performance enhancement of the athlete or the injury prevention strategies, what we can say. Next, we will be moving to understanding that why does majorly the injuries happen. So most of the times when we talk about injuries in our sports athletes, again, I would always recommend that 80 to 90% of the injuries can be put into one bucket known as your overuse injuries. And then little remaining percentage is because of some direct contact or some traumatic incidents or so. But the major injuries happen because of the overuse. And that overuse injuries are something which needs to be tackled before they happen. Understood? So majority times, as I said, that it will not happen that one sudden day the meniscus has withered off or the ACL has torn off. It cannot happen that way. Unless, yes, there is some other athlete banging on the knee of this athlete and then the pivoting forces happen. Therefore, the injury happened. That's a different scenario. That's a traumatic injury or that's a contact injury. When we talk about overuse, it's that the athlete doesn't know or that athlete is not well trained to do those pivotal actions in a right biomechanical manner that results into the ACL tear or some shoulder dislocations or whatever injuries you commonly see. Okay, so majority of the times it is common overuse injuries. Now, since they are overuse injuries, they are going to take years together to come to the surface and show you the symptoms. So as a coaches, as a physios, as a strength and conditioning coaches, it is our duty to see these symptoms when they are actually surfaced before that. So when the athlete is complaining of pain and aches or injuries, before the athlete goes to that level, it's our duty, it's our skill that we should be able to sense that something is going wrong, the mechanics are going on a toss, and we need to fix that. Okay, so that the longevity of the athlete's career becomes better, and that's how the injuries can be prevented. Again, it is an illusion that you can prevent all 100% injuries. Not at all possible. Absolutely not possible. Because as I said, there are contact and non-contact injuries. These overuse are non-contact injuries. Other we have contact injuries. So we cannot make the injury prevalence as zero, but we can definitely work in such a manner that we can minimize the injuries. Or if that injury is going to happen in coming 2 years, we can just push that injury a little far, that the injury happens after 5 years or 6 years, something like that. So keep the realistic goals always. Don't be in that hyper zone that I want to make the injury zero. It's not possible. And now how to sense that whether those injuries are going to happen. So for that, the usual way or the simplest way, what we do is this, that's a functional movement screening technique. So it's an entire big process for which has the FMS has given, which is very, very evidentially apt. And we use it very commonly for our athletes. So FMS, and obviously, in this crunch of the time, we won't be able to go to all the details of the FMS, but just keep these things in mind. Next, for the lower body injury prevention, I always like to see the jump test, because jump test is the test which will make it very easy and very clear for us whether the athlete is able to tackle the forces placed on his or her body comfortably or not. Understood. So that is the main reason why I add jump test to whatever diagnosis I'm doing. The next comes for the lower body, again, is the Y balance test, because again, all the sports, whichever are field-based sports or where jumping, running, sprinting is involved, balance is something which is very, very critical. And the quickest and the easiest way to do that is the Y balance test. So these are always some simple, easy, less time efficient test which you have to have in your toolkit whenever you are delivering it to the athlete. And for the upper body one, we always go for the closed kinetic chain upper extremity stability test. So this will be the test for the upper body. So by default, we are able to screen all the quadrants of the body. It's your upper body, lower body, your core, and your balance. Everything is going to get analyzed in these four buckets of test. So that will give us a very insightful understanding that how the athlete is able to generate force, how the athlete is able to absorb force, and how the athlete is able to transmit force. Because whenever the injuries happen, the athlete is struggling either of these three parts. So where exactly your athlete is lacking, that is something which you should keep in mind. Once that testing is done, once these basic testing are done, then you have to find out what are the sport specific demands. First thing, you have to analyze the athlete, that what exactly the athlete is good at. The athlete is having good power, the athlete is having good strength or good flexibility. What is it? Where is the need of improvement? That we did, then we did the testing, then we will go for the sport specific demands. What does the sport demands from that particular athlete? That is very critical, because we just cannot work our athlete individually. We need to make that athlete ready for the sports demand. Then only the injuries can be lowered. I would not say prevented. We can minimize the injuries, and the strength and conditioning can be a real important part in doing that. So sports specific demands, you have to see the technical skills involved. What are the actual technical skills which needs to be worked upon, which is basically the sports coach's domain. But we as a coach, we should at least have an idea of what exactly the coach is intending to do in the coming season. So that is very critical. Next, we will be working on the motor coordination. What's the motor coordination need, requirement of that particular sport, anaerobic fitness, flexibility, cardiovascular endurance, body composition, and the mental toughness. So these are the buckets again. I like to put the data in different categories. So these are the broad categories. And in that, how much is the requirement of that particular sport? And what is the strength of your athlete that has to match? And that is the critical part, I would say, for preventing the injuries. First is analyzing and sensing the injuries, which we did by those 4 type of tests which we did. Then we are analyzing the demands of the sport, where the athlete knows how it has to be matched with the sport demands. And then we will move towards the sport specific testing, which has to be done for the client. So this is how it will look. Now, whatever is, every sport will need all these categories. Now, out of that category, what exactly your sport demands, that you have to find out. So for example, if it's a motor coordination, so if we take an example of a motor coordination of a table tennis athlete and a motor coordination for a footballer. So let's take an example that they have to do a change of direction movement. So for a footballer, to do the motor coordination in the perspective of change of direction, he or she needs to sprint 10 meters, 12 meters approximately, straight line sprint, then have to laterally move, lateral shuffle, or the lateral speed has to be a component where he's or she's going 5-6 meters left or right, and then executing a change of direction. So that's going to be a demand of a footballer. But at the same time, you take the same example, but here the athlete is table tennis athlete. Now the table tennis athlete also needs motor coordination, also needs agility, motor coordination in the terms of agility. So what type of agility a table tennis athlete will need? He just have to step one step further and then go into the acceleration, decelerate, and change the direction. So the amount of time required for a table tennis athlete is somewhere around 1 to 2 seconds to execute the change of direction or to execute the motor coordination in that particular movement. Whereas for a footballer, that same motor coordination is required, but after approximately 10 to 12 seconds. So that is the difference. That's the sport demand which we need to understand. And if we are able to get that rhythm of the sport correctly, then devising the exercises around him, and if that athlete is injured, taking him through that rehabilitation process, going to be very, very easy and very, very simple. So I always say that when we start a rehabilitation, right, or we need to be sport specific right from day one of the rehabilitation. We cannot say that I will rehabilitate the athlete for 2 months, 3 months, and then I will move towards the sport specific demands. That's not going to be successful. So whatever rehab has to happen, sport specific rehab, it has to happen from day one. And whatever injury prevention strategies you're going to devise through your strength and conditioning program, similarly, they have to start right from the day one. So when you are making that athlete ready for a smashing movement, how that athlete has to push off from the ground in order to reach the highest height to smash, that needs to get incorporated when you're doing a simple baseline, a simple back squat, or you're teaching the athlete a simple lunge. So when you're teaching them lunges, there you incorporate the push-off phase of the lunge so that the client or the athlete knows how to push off from the floor in a very safe manner. That is like a lunge movement, which is very, very simple and easy. From there, they go on building it so that he's able to smash properly and he's able to reach the higher height, jump height, when he or she is going to perform that particular sport specific movement. So this is how we need to coordinate with our athletes when we are designing a injury prevention strategy or a rehabilitation for our athlete. A detailed testing and evaluation has to happen for all the athletes. So voluntarily I have put the total body fat percentage on my first slide because most of the times it happens that we are working only on the strength, flexibility, this and that, and the body composition is something which goes unnoticed, and then we have to pay a higher cost for that. So that should not be there. That should not be the fact. Therefore, testing and assessment is very, very critical. Then we are going for the peak torque production, like how much force your athlete can generate per second. And torque means that's the rotatory force which has to be generated. So these evaluations and testing has to be done when you are dealing with your athletes. Next is another, so this is like when I'm talking about the torque production or the force production, I'm talking about the overall anaerobic fitness of our athlete, that how quickly the athlete can move from one space to other, how quickly that athlete can generate force in that particular exercise. So there's the anaerobic component which we need to target and which we need to test for our athletes. The next one is the most important one. Again, most important, I would not say, one of the critical part, but again, most of the times we miss it, and that is your lung function and the spirometry test, because every sport needs cardiovascular stamina, and that stamina has to be properly tested and evaluated. You just cannot make them run for miles together and then come up with some type of VO2 max testing for them. But you should have a system in place where you are actually working on and seeing how the lung function is improving, how the heart function is improving, what aspect of cardiovascular fitness is improving, at what level, and how, and what's your plan for improving that cardiovascular endurance, because these things are very, very critical. Because if your athlete falls short of the cardiovascular endurance, then definitely the athlete is going to get tired very quickly. And whatever the anaerobic fitness the athlete has generated, it's going to get shattered if the cardiovascular fitness is not up to the mark. So, something which we usually see that most of the strength and conditioning programs don't take into consideration, but I highly recommend that, whenever you're looking, look it from a broad view and not only from the strength or power and flexibility point of view, but get a overall holistic approach for your athlete. Next, we are also working on the proper peak VO2 max testing. Again, working on getting all the aerobic components in the right manner. So as we see that all the four things which we are saying, that if we break down our testing in all those four aspects, that is the body fat or body composition aspect, then comes your anaerobic aspect. Then comes your aerobic. Aerobic may also be clear. You're talking about the lung function. You're talking about the heart function. You're talking about the oxygenation criteria. What exactly you're looking at. So that everything has to be incorporated. And then that gives us a nice, good results of testing and evaluation. And then we move to actually designing the rehab plus strength and conditioning program. And this is something which I always like to go by touching all these aspects, whatever you're seeing those on the screen, all these aspects, but in a step-by-step manner. Don't directly jump over agility or speed right from the strength. You go in a step-by-step manner so that everything is taken care of and the athlete is really ready for, or what we say, the match readiness of the athlete can be, worked upon when you approach each criteria in a proper step-by-step manner. So when I'm talking about the strength, it is again be very specific what I have written here. It's not about just the poundage. Poundage means how much the athlete is lifting, but more critical for our athletes is the technique and its sport relevance. Because that's the major difference between training an athlete and training a general population or a normal non-athletic population. What's the difference? Because athletes' time is very, very precious. Their career spans are smaller. So we cannot dare to waste even a single moment of their training part, And that can happen. You can give full justice to their training only if you have the answer to the why. Why means if you are giving them back squats, for example, you should ask in your mind that why back squat is required for this particular athlete. You cannot just copy paste the programs from the Google or Instagram or YouTube and all and deliver it to your athlete. Every athlete is different. Every athlete's demands are different, and we need to justify that why this particular exercise is going to work for that athlete. Once we are able to get the answer to this why, then there is nothing wrong. I would say there is nothing right or wrong in a strength and conditioning program or a rehab program. If that person is able to justify, if the coach or the therapist is able to justify for that why, then whatever exercises he or she is giving, they are appropriate for your athlete. You can never go wrong in that. Okay. So very, very critical. So from strength perspective, it is your form and technique. So if your athlete is doing, for example, a bench press, okay? And during bench press, the athlete is not feeling the load on the pectoralis major muscle. Rather, he or she is feeling more load on the lower back area or somewhere else in the body or in the upper trap. Next day, after doing the bench press, they say that my upper trap became very sore. Now, that typically shows us that what was the agenda of bench press? To work on to strengthen your pectoralis major muscle. And what is actually happening the next day? The soreness will happen in the muscle which has been worked upon. So next day, the athlete is telling you the soreness is in the upper traps. So do you think that you have done an optimal work for your pectoralis major? Absolutely not. And these are some key pointers which you have to keep your eyes open when the athlete is in the training room with you for the strength purpose. But whatever is the intent of the exercise, whether that exercise is done in that particular form and technique or no, which satisfies that intent. If that exercise is meant for quadriceps, are the quadriceps working? Or that load is going transferred on your latissimus dorsi or quadratus lumborum or on your calf muscles or what? So you should know what is the main primary muscle which is working in that exercise and what are the supporting muscles which are accepted to work in that exercise. You cannot have those supporting or the accepted muscles to do the primary work and the primary muscle is working as an accessory muscle. That cannot happen. So that's what I try to mean by technique and the sport relevance, rather technique, form and technique of the exercise. And the sport relevance is again whether that particular exercise is going to actually bring any effect in their on-field performance or no. That you have to be very clear with that. But what season your athlete is, he's in season, off season, pre-season, and how this exercise is going to give me results during his in season, during his match, how this exercise is going to make him ready for his matches or for his competitions. You should have an answer for that. If you have, you're absolutely right and move on with that exercise. So that's the beauty of the strength exercises. Then again, same thing goes for the power. Teach your muscles to utilize their strength at the optimal level. So first, always build up the foundation with the strength and then execute it with the power. Endurance, again, very critical as we have already discussed about the endurance. So we are always going to say push harder than yesterday if you want different tomorrow. So that's what, but again, in endurance, we can say that because endurance, you have to go on building up the mileage. You have to go on building up the volume in a very graded manner. So, and again, when you are working on the endurance of the athlete, make sure that what exactly you're targeting the lung function, you're targeting the oxygenation, or overall your VO2 max, how you're going to do that, what are the strategies you are going to incorporate in that. most critical now. This is something which most of the athletes ignore. Like that's what again my experience is, because athletes love lifting heavy weights. They love doing the powerful and explosive movement. Endurance also, yes, they love it, but they just don't love doing the flexibility. And that is something which, in a long run, that is something which creates trouble in our athletes, and they have to pay a cost by getting injured in multiple ways, because the muscle is becoming stronger. The muscle cannot lose the quality of elasticity. So if it is becoming hypertrophied, if it is becoming stronger, able to generate more force, please at the same time work on building up the elasticity of the muscle also. Similarly, for the tendon, we call it as a tendon stiffness. So tendon stiffness is we are making the tendon resilient for the forces, for the loading. But at the same time, the natural physiological length of that particular structure of the muscle or of the tendon should be preserved. If that muscle or tendon is becoming shorter because it has to generate forces, then that's not a right approach. We need to balance the strength and flexibility. That's a misnomer which you can hear many a times, that if you build on the strength, you are going to lose the flexibility. That is absolutely wrong. Even even the hypertrophic muscles need flexibility. So keep that thing in mind. If you don't focus on the flexibility, or I would say joint mobility, these terminologies, flexibility is more towards your soft tissue, mobility is more towards your joints. If you miss on these things, then mind it that injuries are definitely on their way. Nothing can prevent that. So just take a nice, good control of the flexibility aspect of the program. Then the proper plyometrics. Plyometrics, it is far better to be exhausted from success than to be rested from failure. So that means that plyometrics are highly intense movements where you have to teach our athletes the two things. I always focus on plyometrics. Now, this is something, again, I see a lot of gap in between. So most of the times, many strength and conditioning programs or the rehab programs have the plyometrics, but the agenda of that plyometric is to teach your athlete to generate force. Rather, I would always start that this should not be your first criteria. Your first criteria should be the second one, that is to teach your athlete to absorb forces. The more better the athlete can absorb the force, the more easily the athlete can generate the force. So be very clear with what exactly is your priority. We are working towards preventing injuries in our athlete. So the injuries can be prevented if your athlete knows how to absorb the force. Because whenever you see any injury happening, you will never see that the athlete is jumping and he gets the injury. Jumping means he's taking a tick off and then he's getting the injury. It's very rare. Now, what is he doing when he's taking off? He's generating the force. He will never get injured in that. Athlete will get injured when he lands in the wrong manner. And what is he doing when he is landing? He is absorbing the force. So when your athlete doesn't know how to absorb the force correctly, by no chance the athlete can prevent the injuries or can minimize the injuries. So always focus plyometrics first thing, because we are able to generate power. For power, we have Olympic lifts. But then why we add plyometrics also in our program? Both are generating power. So what is the beauty of the plyometrics? The beauty of plyometrics is the force absorption, teaching them to how to absorb force, how to work as a good shock absorber. And for that, you need to have a good foot mechanics. You need to have a good landing mechanics. Your deceleration training should be a part of your, plyometric force absorption training. So these things should be highly, highly put into the picture in order to enhance the training of your athlete. And the next one is your speed training. So you need to be very, very specific about what speed movements you are going to incorporate. Again, the speed has to be very, very sport relevant. Here, you cannot just, waste time in doing any XYZ speed movements, because nowadays on our social media and everywhere you see so many speed drills are there, but they make sense to you only if they are sport relevant, only if they are biomechanically and metabolically matching your sport demands, then only you're going to incorporate those type of speed drills. So that is very critical. The last one is the agility. Agility is like reacting to the stimulus and moving in that direction, or the change of direction with the perception of the reaction to the stimulus. So these two combination makes the agility. So that is again very, very sports specific. So just remember to add those things in a proper manner. That's all from my side when we talk about the rehabilitation and the injury prevention strategies for our athletes. So we will now get back to Stefan. Let's see what he has to say. I just stopped the share screen here. Yeah.
Hi, Dr. Apurva. Thank you for taking us through the session through in detail. We will open this time out for questions. If any one of you have any questions which came in specific while listening to this topic, you could just ask of it in the Q&A section in the bottom bar which you see. Or if there has been any other topic relevant question which you would like an expert like that of Dr. Apurva's insight from, that also you are free to put across. So we have this one question from a person named as Sanket, and he's asking, what are the key mistakes practitioners make during the RTP phase?
So as I said, that not considering the sport demands and what are the strengths and weaknesses of your athletes and what are the strength demands, not able to match that. That is the key mistake which I always see. And another thing is not approaching in a proper step-by-step manner. Right from, like I would say, from step 1 directly jumping on to step 5 or 6. That is the another mistake, loading too early or loading too slowly. Both of the things needs to be optimally managed in order to get a good RTP continuum. So that's what I feel.
Perfect. Thank you. Sanket, hope that question of yours is answered. The next question which we have is, how can better collaboration between the SNC coach and rehabilitation professional reduce re-risk injury?
Yes, absolutely. So a rehabilitation, as I said, the first thing is rehabilitation right from day one has to be very, very sport specific. The physio, the therapist has to know that why this particular exercise and how this particular exercise is going to have an effect when they are going to be on court. So that is very, very critical. And as they progress through the rehabilitation phases, later on handing it over to the strength and conditioning professional is very critical, because see, every professional will have their own strong points and their own limitations. So there will be a time where the athlete has to be transferred from the rehabilitation to the strength and conditioning professional. So a strength and conditioning professional should know what exactly is the injury and how it has been tackled. So that communication between a physio and a strength and conditioning professional is very critical. So for example, if it is an ACL athlete and while doing a squats, if the physio had to invest a lot of time in getting his gluteus medius working, Okay, so this key information has to be transferred to the strength and conditioning professional to make him or her understand that the gluteus medius activation is poor by default in our athlete, or he took a lot of time to get that muscle memory back. So these key pointers has to be communicated. Otherwise, the strength and conditioning coach will be completely disoriented. And if in future he puts some movements where the pelvic stability has to be done, the gluteus medius is not that greatly firing, then definitely the performance of that entire process is not going to be optimally achieved. And then athlete is going to be, the sufferer for it. So that communication, that what has happened during this rehabilitation zone of 2 months, 3 months, and what challenges the physio has faced, that needs to be communicated to the SNC. And if that SNC needs that why these things are going haywire with your athlete, connecting that to what exactly the injury was and what was the mechanism of injury. That communication from a SNC coach to the physio is very important. So I think that the communication builds up a good, working atmosphere, and end of the story, we are able to help the athletes optimally.
That was really insightful. Thank you. I think we can take up one last question for the day, and we already have one. The question states, how can new strength and conditioning experts ensure that their injury prevention strategies are evidence-based while still being adaptable to the real-world constraints such as time and resources?
Oh, currently, I think the resources is not a constraint in this social media age. So, 10 years before it was a problem, but now the resources are so easily available. You have so many research papers and articles and the experts around you talking to you. So, the resources is not an issue. The new SNC coach, I always say that if you want to build up your expertise, first, as I say, try to get answer to each and every why which you are having. So whenever you are drafting a strength and conditioning program for your athlete, rather than copy pasting it from here and there, sit with your athlete. Sit with your athlete's case study completely. Understand what are the problems and how you're going to find out the solutions from which exercises, and why these exercises, why not the other exercises, what can be the best exercise at this time for your athlete. Just spend that homework, or just do that homework with your athlete's case study, and then just try to execute. You might go wrong many times. We all have, many a times have gone wrong, has not able to give results, but that's a learning. That's how you build on, and then slowly and gradually you become an expert in that. So just by looking at the athlete, you come to know what's going wrong, what is the need for that athlete, and everything. But the start has to happen by taking that athlete, each and every athlete, seriously, and understanding their case study in detail. And now, since as you have a constraint of time and all, so don't work with each and every athlete in that detailed protocol, but at least keep the target कि पूरे week में, if it's a full week, at least in that 1 week, I'm going to spend time studying about this one particular athlete. So this time I'm taking a track and field athlete. Next week I'm taking a football, or like whatever athletes you are working with, or with injury. So this time I'm taking this athlete with an ACL tear. Next time I'm taking an athlete with another sort of, some meniscal tear or shoulder tear or something like that. And then go to the crust, go to the main source of issues what the athlete is facing from the rehab perspective, from the strength and conditioning perspective, from injury prevention perspective, and read, research about it, implement your knowledge on it, and see whether it works, not doesn't work, what is it. Because that much, so since you're a qualified strength and conditioning coach, so I am very much guaranteed that you will not do any harm to that patient or that athlete. but at least do some trial and error to see which style of treatment or which style of managing or training works for that athlete. So that's how I did it during my young days. So taking one athlete at a time, going through it, and then in the next few days, then the other athlete. And that's how we build up, our style of training. Yeah.
Dr. Apurva, if you're okay to take in one more question, we already have one.
Yes.
Okay, all right.
Sure.
This one seemed to be from SNC itself because this is actually a very relevant question. So from your expertise as a sports physio who have been in this industry for this long, what are the biggest gaps you see in the beginner SNC coaches who are entering into the industry today? And as per you, how can they prepare themselves better?
Yeah, so just now what I explained, the biggest, it's not like a gap which I see or anything like that. It's the personality traits. The one who puts in more efforts, 10 years down the line, that person is going to be the elite coach. It's as simple as that. So it happens in every generation of strength and conditioning that all of them are passed out at that level. Everybody that if you'll see the new aspiring coaches, there will be a huge bunch of coaches who are new, just novice, starting their career. The one who puts more efforts in understanding their athlete, in researching and keeping learning themselves, learning new ways of training and everything, that coach 10 years down the line will be more experienced and will be more expert as compared to the other coaches. So if you want to really take this profession seriously, I would say take your each athlete seriously because we are working for the athletes. So that is the only expectation what the field demands. So take each and every athlete, take each and every person whom you are training. If you're not training now any athlete, if you're training a general client, general population, non-athletic population, take them also seriously. After all, it's a human body. You don't have a different anatomy in them. So it's a human body. Learn, understand, find out why the body is behaving like this, why the exercise is behaving like this, why this exercise is creating this effect. Go to the root cause, invest time in that, and you will sail through it wonderfully. You will be proud at towards the end of the journey. You will feel very contented about it.
Thank you so much. If you have any further questions, we would still encourage you to write back to us at the same email ID from which you have been, guided towards the registration and everything for this webinar. So you can always reach out to us through that. And Dr. Apurva, if you have any questions, I could pass it down to Dr. Apurva, and she would be happy to respond back to you as well over an email. That being said, we come towards the end of today's wonderful session. Thank you so much once again, Dr. Apurva, for sharing your valuable insights and expertise with us. And at the same time, we would like to thank all the UCAM India and UCAM Spain team members to making this webinar a success, especially to Dr. Sunil Rongala and his leadership. Thank you, everyone. Finally, to each of you participants, thank you for your active participation and your patient listening. I'm sure you are going to go back from this webinar with at least a trait learned towards your better hands-on training for your athlete, for your patient, for your client, and I'm sure you will be bettering their lives through this webinar. We also encourage you to stay connected with us with UCAM India for more such webinars, academic programs, as we spoke about at the start, and all the other career-oriented initiatives which we do towards the strengthening of sports science and high-performance sport within India. Once again, for more such informations, if you are interested, we are just dropping the details down into the chat for you to look into our website and also to reach out to us on our WhatsApp, for we would be happy to guide you further. That being said, have a great day ahead. On the note of the webinar theme itself, stay safe and hope to see you again soon. Thank you, Dr. Apurva. Thank you, each one of you.
Thank you.